Our next speaker, who is Professor Roger O'Sullivan, and he is the Director of Ageing within the Institute of Public Health and Visiting Professor at Ulster University. He was previously the Director of the Centre for Ageing Research and Development in Ireland, and he has written, edited and published mainly in the areas of ageing and older people. And he was awarded membership through distinction of the Faculty of Public Health UK in 2017, and in 2020 he was made Fellow of the Gerontological Society of America. And his talk today will cover the GALOP programme, which is generating active lives in older people. So we look forward to hearing his talk.
Okay, thank you very much. I'm going to check the sound here. Can everybody hear me? So I'm going to talk about physical activity. But before I do that, I'm just going to try this. I'm not sure how it'll work because of the spacing. Probably not suitable maybe in the middle row. But if you want to, just stand up where you are. Okay, just be safe. Okay. So, I did this test. I do it reasonably regular. So, if you want to stand on one leg. Okay. So, now just, okay. Yes. Okay. So, that's easy, hard, difficult. Okay. So, I'll do it as well. Now, close your eyes. Okay. Little wobble. Okay. So that gives you a feel about your core strength. If there's any physios in the room, they'll explain that much better than myself. I did that there recently at an over 50s test. So I went along and it was great. I did the walk. I did get up and stand. I did all the different, and then I did the stand on one leg, and then I did the close the eyes, and I went, oh, I'm wobbling. And the good news with that is you can practice that. So when you brush your teeth tonight, when you brush your hair tonight, you can do it on one leg. It's a really good indication of your overall strength and fitness. So the good news is you can get better at that. Okay? So this presentation will focus on the Generating Active Lives in Older People programme, GALOP. The research element of this programme had a number of aims and objectives. Our overarching aim was to develop our understanding of the role of healthcare professionals in promoting physical activity to older adults in a bid to increase physical activity levels among the older population. So in this presentation, I'm going to cover the background, the research process, the research findings, the movement to implementation, and some lessons along the way, which I hope will be helpful to you in your research and in your work. So let me briefly set the context for this presentation. So today you've probably heard on the news, our population has reached 8 billion in the world. So, the good news, at the local, the national, the European and global level, populations are getting older. That's the good news story. The bad news is we're not physically active as we should be, and we really need to get more physically active. Data from both Nicola and Tilda show us that the pattern of decline is evident on the island of Ireland as we age. In 2018, 2/3 of the participants in Tilda, aged 50 plus, reported low or moderate levels of physical activity. Low-level physical activity is almost twice as prevalent in those aged 75 plus compared to those aged 50 to 64. The World Health Organization recommends 150 minutes of physical activity per week and strength building on 2 days per week. Clearly, many older adults are not obtaining the range of physical and mental health benefits of physical activity. Too often, ageing is met with a decline of physical activity, but also with a loss of functional independence, premature morbidity, and a decline in quality of life. But that doesn't need to be the case. So, as a researcher, I wanted to find out about how do we make people much more physically active. And I was really interested in the role of healthcare professionals, the importance, the trusted position, the chance that they have to have a conversation. So in a typical way, and this may be useful for the researchers in the room, we went through like a 4-stage process to get there. The first stage was to undertake a review of the evidence around the benefits of physical activity for older people. So a systematic review. In 2019, IPH with partners in Ulster University conducted a systematic review of published literature reviews related to physical activity and health outcomes in older adults. So the review found that being physically active has a role in chronic disease prevention and risk reduction in relation to cancer and cardiovascular mortality. It has a role in improving functional status, in quality of life, and in improving mental health outcomes. Now, this review also examined and found a reduction in cognitive decline, Alzheimer's disease, for those older adults who met or exceeded the guidelines in comparison to their inactive peers. The most important message for researchers, practitioners, and policymakers was not only the numerous benefits gained from being physically active as we age, but the actually greatest benefits were seen among those older adults who went from being inactive to active. Some is better than none. It's a very simple message. So that's a really useful thing to take away. If you take nothing away from this talk today, some is better than none. It's never too late to start. Okay, so that was a systematic review. It was a review of reviews. For anybody who hasn't actually undertaken a systematic review, there are brilliant courses that show you actually how to go through the process. I would recommend you do it, or work with somebody who has actually undertaken a systematic review before, and then you learn the tools and the skills that are required. So the next stage in the GALOP programme was to do a review of policy around physical activity promotion on the island of Ireland, and explore the implications of those policies for promoting physical activity to older adults. You can see we have a range of policies across the island of Ireland. And in a nutshell, I better just close that so you can see on the top part of my slide, apologies. It's recognised physical inactivity is one of the most important public health challenges facing older adults on the island today. So if you think about physical inactivity and you think, okay, so many things are now so easy, we don't have to move from our seat. You can sit on the sofa, change your television, you can make the phone call. And for those people who want to order something in, you can get it delivered to your door. You can't get it delivered to your sofa yet, but there's something there about recognising our sedentary behaviour. Okay? Healthcare delivery must increase its focus on improving health and well-being through prevention rather than treatment. Obvious, of course. But this requires a cultural shift in service provision on the island of Ireland. In a nutshell, to unlock the benefits of physical activity across the life course, it's imperative that policy and practice support older adults to improve and maintain their health and well-being by achieving the recommended levels of physical activity. So, the review also looked at the range of policy and frameworks and highlighted the growing body of evidence that healthcare professionals have a key role to play in supporting health service users to understand the role of physical activity. Evidence suggests that they can impact patients' behaviour by assessing physical activity levels, by using brief practical interventions such as advice or counselling on how to initiate and maintain healthy behaviours with link to community-based supports for behaviour change. Preventing and reducing chronic disease across the life course requires a shift on promoting health and well-being through strategies that focus on health promotion and disease prevention. So that was the secondary data, Now we moved into the primary data collection. So we undertook a cross-sectional survey of healthcare professionals in Ireland and Northern Ireland. All the articles that I cite are open access, so please feel free to look at them. You may be interested in a different part of the light course. You may be interested in a different group. You may be interested in a different topic area, but hopefully the methodology and the process that we followed will be of interest to you. So in phase 3, we wanted to explore healthcare professionals' knowledge, decision-making, and routine practice. So we looked at 4 groups: GPs, OTs, physios, and nurses. We established a research project advisory group made up of those 4 groups and from the professional bodies across the island of Ireland. They were so essential to advising on the research component of the project and actually of the content of the survey. The survey had 3 parts, and I'll talk about that in a second, but we really wanted to understand and explore healthcare professionals' knowledge of the clinical guidelines and explore the factors which make their impact on their judgments and decision-making in promotion of physical activity to older adults. Okay. So we undertook a cross-sectional survey. We had the first part was about the healthcare professionals. The second part was around the knowledge of the various different guidelines. And the third part, we had clinical vignettes, clinical case studies developed by the advisory group. I strongly recommend that as approach. It really is very insightful. So for the research team, it was important from the outset that we aligned the questions to a theoretical framework, which helped us understand individual and organisational determinants of health professionals' behaviour in assessing, discussing and prescribing physical activity. In the paper that I cited before, you're able to read about the theoretical domains framework. It identifies the influences on healthcare professionals' behaviour in implementing evidence-based recommendations. So, we ran the survey. It ran between August 2020 to October 2020. To take part, you had to be registered as a GP, a nurse, a physio, or an OT. You had to be practicing in Ireland or Northern Ireland and have current clinical contact with adults as part of the routine practice. We had nearly 600 responses to the survey, and then when the data was cleaned, that brought us down to 347. This is a convenient sample, so it was people that was interested. Now, I'll talk about some of the challenges in terms of those survey methods, but again, for the researchers in the room, you recognise the limitations, you write about that, but it is still extremely valuable and insightful data. Okay, so 86% were female, 75% were based here in Ireland. Nearly half of all respondents were physiotherapists. Nearly a third reported that they had 26 or more years of practical experience. So, the findings. Respondents, so knowledge, understanding, and the use of physical activity guidelines. Responses varied considerably across professions. A third of all respondents agreed that they were aware of the contents and objectives of guidelines for older adults. In terms of the components, 1 and 2 of all respondents correctly recalled the number of minutes of moderate intensity physical activity. 27% correctly recalled the number of minutes of vigorous physical activity on a weekly basis. 52% correctly recalled the number of days, and 24% of all respondents correctly recalled all 3 respondents. So broadly, these findings indicate that general knowledge of the guidelines of physical activity for older people is an area for potential development of knowledge and skills. Okay. So where do you get your knowledge from? So you as healthcare professionals in the room, where do you reference? If you want to find something, where do you go to? And in terms of physical activity, we wanted to know this. Was there a go-to source? Was there a gold standard source that you went to? So responses varied by health profession when asked about their awareness of their resources for facilitating their knowledge, development and practice of discussion and prescriptions of physical activity with patients as part of routine practice. So you can see many people went to the Department of Health and government public health websites, but it varied. So that was also giving us a message. In terms of assessment, discussion and prescription, nearly 50% reported they never formally assess whether a patient is active or inactive as part of routine practice. So you think about when you go to your GP, the questions that are asked. Are you talking to a public health nurse? Are you chatting to a physio or an OT? So overall, I didn't break this down for this presentation by the group, but nearly 50% reported they never formally assess whether a patient is active or inactive. 70% agree that discussing physical activity with patients was part of their work as a healthcare professional. 30% of all respondents agreed that they had received suitable training to initiate conversations. And 30% agreed that they had a clear plan of how to initiate discussions about physical activity. Okay. These findings, in terms of prescribing, 12% of respondents always signposted patients to other physical activity services. And most respondents agree that assessing, discussing, prescribing physical activity with an older adult as part of routine practice would benefit the public health agenda. Fewer agreed that they were supported to use physical activity assessments, discussions in everyday practice. So again, these findings relate to the assessment, discussion, prescription, and the potential areas for development. So, key considerations. Discussing physical activity is the job of a healthcare professional. That's what they've indicated. Majority had not received suitable training to initiate discussions. Few had a detailed knowledge of the specific components of physical activity guidelines. The important theoretical domains were knowledge, skills, and behaviour regulation. Support requires components of knowledge and skills development and resources that all healthcare professionals can use to promote physical activity with their patients. So, the important thing here in this survey was not only to indicate what you believed is the number of minutes, but actually to correctly indicate the number of minutes of physical activity a week. Okay. Now, methodologically, it's worth noting that this survey may have attracted people who have an interest in physical activity and promoting physical activity. But if you think about that and you look at the numbers and you look at the percentages, you indicate that actually if this was a representative sample, the figures may change in a different way. So let me go to part 4. Again, this article here is available on open access, and we wanted to give voice to the healthcare professionals. We wanted to ask them, what did they think could be done? What should be done? So we wanted to develop our understanding of the themes and concepts which emerged from the survey and to explore other areas in more detail with the healthcare professionals. And we really wanted to enhance our understanding of how did it differ across professions, how did it differ across settings, and what did they consider as important. So the method, I won't labour this. It was during COVID, so it was via Zoom, 30 to 40 minutes. We focused on assessment, discussion and prescription in the interview. We asked about knowledge, how they developed their knowledge, how they implemented it in practice, and their decision-making, the barriers and facilitators and models of good practice. So in terms of the numbers, 63 participated, 10 GPs, 19 OTs, 24 physiotherapists, and 10 nurses. I won't go through this in detail, but if people have experience of Navivo, it's a great package. This is described here in one slide, but you could imagine that's many, many months' work. It involves coding and then mapping it onto the relevant theoretical domains framework and generating different sub-themes. The advantage for people who haven't been trained in Navivo, I would encourage you to use it because, say for example, if you have a research assistant working on your project, if they code it and you're also skilled on it, then whenever they move on or if they stay with the project or you go back to look at the project, you've got the data that you can actually find in one location. Unlike historically, the traditional way where you had colour markers on a page and you went back through the book trying to remember what. Navivo's a really, really good package to help you. But again, training's really important and it's available here in Ireland. Okay, so the findings. We wanted to find out about applying physical activity to routine practice, a broad recognition of the benefits of physical activity for patients' health, and participants reported a wide range of sources to support their knowledge. Many healthcare professionals acknowledge that the fundamental knowledge of physical activity and its role in prevention and treatment did not come from their undergraduate or postgraduate training, but actually through their own exploration in education and training. So again, there was something coming through about the need for training and support and the need for continual professional development in relation to the promotion of physical activity. Again, knowledge and use of physical activity guidelines varied among healthcare professionals. Applying physical activity to routine practice, many acknowledged that being physically active was part of their identity, and that's why they recommended physical activity, which was quite interesting. Multidisciplinary teams were highlighted as invaluable as an organisational support for physical activity promotion. And again, a culture of promoting physical activity at a departmental organisational wide was important to ensure the effective application of physical activity promotion. So, if we're talking about physical activity promotion to patients, is the organisation that you work for or the professional body supporting you to get your own physical activity? Do you build physical activity into your working day? We're all sitting now. I've just got you to stand earlier on, but do you build it in? Do you sacrifice physical activity for other things? We know there's a gender issue with regard to men and women with regard to their physical activity, but do you put physical activity into your calendar like the way you put a meeting in, or writing a report, or reading a report? And that's an important way to recognise it, and recognise physical activity as part of your lifestyle. Okay. So again, integrating physical activity into routine practice. The assessment of physical activity was informal and identified as an area for potential continuous development. Assessment of a patient's status was more structured, but in terms of their structure and function rather than physical activity. So, in terms of barriers, lack of time, lengthy patient waiting lists and a large caseload, limited resources, staffing levels was a common cited barriers. Lack of clarity and consistency between the use of terms and meanings around physical activity and exercise. What are they? Okay. Training in the area of a behaviour change. So these were different issues that were coming through. In terms of referrals and signposting of patients, it is of course difficult to signpost someone to a physical activity resource if you're unaware of those. So again, making sure that you're aware of what's in the area and what's suited to the person that you're talking to. What part of that is finding what interests the person. Is it dancing? Is it walking? Is it cycling? What is it that interests the person, and trying to get them to think about it. This was an example of actually a physiotherapist talked about. We were told that older people wouldn't come in for the exercise class. We were told they just don't do it. And I think by the end of our class, we would have run 3 classes over a week and had 45 participants in. So there's something there about, yes, but sure, other people may not want to come to classes, so you have to think about what works. So, key considerations: supports identified, continued education and skill development, and increased service provision. And again, that relates to the previous point. Supports identified by healthcare professionals, invest in prevention. Yes, clearly. And again, I thought this was quite an interesting one. The physical awareness campaigns, not just for the public, but actually for staff. And that's a useful message. So as ourselves, I'm going to show you some of the options, and you may want to take this in your own time to check your own knowledge around physical activity. So, in terms of key considerations, the supports identified training and practice, an integrated model of practice to be part of an established culture, linking in to the community of practice to understand what's going on in the community and what suits the patients that you're working with. So, now, in summary from the GALOP project, the evidence established the benefits of physical activity to everyone as they age. The policy agenda supports physical activity in practice. The research in this paper paints a picture of current practice. It highlights the need for focused education, appropriate training, tailored resource identified by healthcare professionals. And they felt this was essential to support the promotion of physical activity in routine practice. For such supports to be effective, there needs to be a cultural shift, both in our training and our health service provision, and a range of support programs and campaigns to develop a wider knowledge of the role of physical activity in health. At the core is the need to think about and move forward in service and practice development, the routine application and integration of physical activity through its promotion in the health service. So, in terms of outputs, I've got these great outputs. Okay. But that could be the end of the project, but it wasn't. Because it came up over and over again. We need training. We need support. So our next stage was to think about how could we actually do that? How could we do something that will be helpful to the healthcare professionals that have been part of our work? So, implementation, a learning pathway. And again, I share this as something that may be relevant to your organisation, your work. If you recognise a deficit and it's not being filled, what do you do? So in light of the findings of the research project, IPH set out to develop an online learning pathway in training activity. At the end, it was called Get Active for Better Ageing. This is aimed at the four healthcare professionals from the GALOP research project, as well as other allied healthcare professionals or persons with an interest in promoting physical activity to older adults. So the research part took over 3 years, probably took a year before the planning even started. The implementation part took 1 year. So the stages of the development. We undertook a scoping study to see was there any existing courses that covered this area, and we didn't find any. We then went and looked at the undergraduate degrees for those 4 professions to see was it covered, and it wasn't. Okay, or not in the level of detail that would be required. So we established an advisory group, again, of the 4 healthcare professionals, North and South. The advisory group were excellent in advising us about the realities of practice, the realities of time. we used the content from the research project to devise the training program. We developed the first version of the pathway and presented to the advisory group for feedback. It was a great experience because they were very helpful and they gave us very useful feedback, and they told us what there was too much of or too little of. And so we updated it. One of the ones was around behaviour change conversations. We had only touched a little bit, but how do you initiate a conversation? So it's okay to say, do you check, do you smoke? Do you take alcohol? But then a conversation about physical activity was that little bit more difficult. And again, with time. So we presented a second version and further reviewed. We shared it to both the HSC and the PHA. And we included a behaviour change component. We secured a budget internally to move this from from a PowerPoint to an online resource. And a specialist company and our communications team developed this. We brought an alpha build, which is really just the first visualization of this, out to the healthcare professionals. And again, it's really interesting when you develop something on a PowerPoint or a piece of, a Word document, and then you move it on visually, what works and what doesn't. So we got some brilliant feedback and we made it much better. And then we built the pathway and it was launched on the 20th of October. So I'm just going to talk you through this just briefly. So the aim was to enhance the knowledge of the benefits of physical activity among healthcare professionals, to increase the ability of healthcare professionals to promote physical activity to their patients, in particular older people. So at this stage we have 6 activities. Key facts, figures and information on physical activity. A quiz where you go back and say, well actually, were you taking in what you were going through in the previous section? We have examples of behaviour change. The clinical vignettes that we used in the survey, we reused. They're really good. And so you're given a clinical case study and then you're asked 3 questions. Would you recommend physical activity or would you not? Or are you unsure? Those were the same questions in the survey. Then we actually have behaviour change conversations in routine practice where healthcare professionals illustrate how they have their behaviour change conversations, and then resources to support physical activity. So this is just an example where it's a click up and down, move across. So here's just a typical question. How many minutes of weekly physical activity are you recommended to attain health benefits? 60, 90, 120, 150. So people click that, and if they get less than 150 as the answer, they go back and say, it's 150, try this. Then this is the real life case studies. So where we are, it's launched. We'll be continually updating this with new physical activity focused content, resources and research as it becomes available. It's on the Public Health Matters. Public Health Matters is the name of the app. You can download it from any of these 3 systems. Please download it, have a look, think about it for your own area of how you might want to adjust something as a model, because that's what I thought would be useful for you. The learning, let me just cover this just quickly. The importance of partnership and gatekeepers, that's really important. You've all heard this before. If you want to go quickly, go alone. If you want to go far, go with others. It's the same thing in research. And that's really important, the importance of partnership, not just in Ireland, but across the island of Ireland. The user voice. The voice of the healthcare professional was so important to inform our work, to help us what would be useful, what wouldn't be useful. The realities of practice, time, pressures, training. On a typical day, how many emails do you get into your box? How many do you get a chance to go through in detail? And so we were being advised, okay, there's lots of training. What will make yours different? It takes time. It takes time to skill yourself up as a researcher. It takes time to skill yourself up around physical activity. but it's a skill that will actually be with you until the next update comes out from the WHO. Okay? So I would say give yourself space to enhance your knowledge and learning around research, the different parts. You will have a skill set, and you may want to enhance that in that particular area, or you may want to explore into other areas. That's the great thing about being a researcher. In terms of physical activity, it's a great area. It's a great area that there's a lot of energy and interest at the minute. So, check out the app. And lastly, it's just to say, I couldn't have done this project without these people, because they were the Generating Active Lives Implementation Advisory Group. There was the previous research group, and also the research team behind this presentation and this piece of work. So I hope you found this a useful presentation, and thank you very much for listening.
Thanks very much, Roger. I think we can say that was an absolutely excellent presentation. I think we will have some homework with that balance test, and very thought-provoking as well in terms of, I suppose, our own approach to physical activity and how that translates then into interactions with patients. And of course, the area of improving physical health outcomes in mental health care is so important and so topical at the moment. And what I really liked about the presentation was how thorough it was, and it drilled down into that kind of whole systems approach. So thank you very much.